Thank you, Rhonda, Sarita. Thanks so much for joining us. I'd like to hear from you how you got involved in this national conversation on caregiving, because I think so many people have personal stories. Sarita?
Yes, well, in addition to the work that I do to promote caregiving issues, I am a full-time working family caregiver. I care for a father who has Alzheimer's and a mother who has pretty severe mobility issues, who lived with me for many years and now lives in an independent living community. But I sort of feel like I've been swimming in this issue of what it means to be a family caregiver and work full-time.
Rhonda?
In my experience with the issue, I actually started professionally. You heard a reference earlier to the National Family Caregiver Support Program, and I worked on the Hill and on the committee that helped bring that program into law to help support family caregivers. And it was an area of interest for me professionally, and one that I wanted to further work on. So I went to AARP to work on issues around supporting family caregivers and helping people live independently in their homes and communities, because it was an issue that really resonated with me, and I saw how it would make a difference in people's lives. And since then, I've become a caregiver for my own parents, especially my mom, working with my siblings and other members of my family. So it's also personal and professional for me as well.
Now, you have some interesting numbers for us. Can we talk about those right off the bat? Because I think they're really fascinating.
Sure. There's two slides. When you heard earlier folks say that this is an issue that really just impacts just about everyone. Almost everyone has a caregiving experience. And there are about 40 million family caregivers nationwide. And if you put a dollar amount on the unpaid care that they provide annually, it's about $470 billion. Wow. And on the next slide, you can see how that compares. That was larger than the entire Medicaid program in 2013, about the same as the sales of the world's largest company and the sales of the 4 largest U.S. tech companies in that same time period. So the scope of the assistance that family caregivers provide to their loved ones is really significant.
So we had a panel earlier, and I don't know if you both got to listen. I think, Sarita, you were caught up in this snow and family issues, caregiving and kids, all the rest. But they talked in some detail about the RAISE Act. Can you help us fill in the blanks and explain to our audience the difference that it's really going to make in the lives of caregivers every day?
Well, for one thing, it's a real acknowledgement of caregiving, which really in our culture and even through policymaking, we have not valued care and caregiving relationships enough. So the fact that there's this legislation is amazing because it really is sparking the conversations that are needed. It's also really important in terms of families being able to take what has felt like such a private issue and be able to see that others are also struggling with...
They're not alone.
They're not alone. And that this is a way we can come up with solutions together. As a nation, we can, in fact, acknowledge the caregiving responsibilities that so many people hold. So I think it just starts a whole new conversation, both on the policy level, but also sparks a whole new cultural conversation as well.
Rhonda, can you help us understand exactly what it's going to do?
Sure. So the legislation requires the Secretary of Health and Human Services to develop a strategy about how to better recognize and support our nation's family caregivers. There's an advisory council appointed made up of different folks, including family caregivers and people they assist, and a range of different service providers, employers, officials at state and local levels, just a whole array of folks that may interact or in some way be able to support family caregivers, and really creates a table where they can have a conversation and really talk about the needs and the challenges the family caregivers have every day, and what are steps that different folks in the private and public sector can take to try to help support family caregivers and address the challenges that they face every day. And it's starting that conversation and bringing people together, elevating that issue and creating a forum to help develop solutions.
So it creates this forum, it creates this strategy, but as I understand, there's no real additional funding appropriated, is there, for HHS?
There was just some funding for the development of the legislate for the advisory council and things like that to get it up and moving forward. So we're fortunate to have strong champions on the Hill to help make sure that this legislation is implemented and moving forward. And we are certainly, AARP and working with a lot of organizations that we partnered with to make this law, are going to continue to help make sure it's implemented.
Yeah, I was going to say, I think that was pretty extraordinary. So many organizations came together to make this happen. It was so incredibly collaborative. Why now? Why this law now? I mean, this has been an issue for years.
Well, I think the demographic shifts alone, I mean, the demographic trends do that. I mean, we're in the elder boom. We are no longer a few years away from the elder boom. We are in the elder boom. Mm-hmm. And so at the same time that we have about 4 million people aging into retirement age every year, we also are experiencing the first wave of millennials having children at a rate of about 4 million per year. So families, individuals like myself, who are literally sandwiched in the middle, we are really struggling with how to meet the care needs on both ends of the spectrum, let alone ourselves, mm-hmm. right? So the numbers of people who are being impacted by this issue are just growing. And we understand, you know, when I talk to families in states about these issues, they will say to me, you know, there's no support in place. There's an assumption of women's unpaid work, right? We have a system that is based on an assumption of women's unpaid work from many decades ago, and that's just not our reality anymore. Women are in the workforce. This is a major issue. Families are being squeezed on the financial end, let alone the emotional and physical implications. So everybody has a care story. Everyone is being touched by this.
Rhonda, what's coming next? I mean, what didn't make it into this legislation? I thought it was interesting that the congressman said this is a good first step, but it's not the final step. And the congresswoman talked about some long-term care legislation. Mm-hmm.
Well, this is it is a first step to help have the conversations, look at what are some potential solutions, and help spark changes and solutions both in the public and private sector. The strategy looks at an array of issues, everything from respite options to workplace and financial issues to sort of the healthcare and long-term care setting. So it does cover certainly an array of areas. There are certainly other solutions may come out of RAISE, but there are certainly other areas for legislation in addition, whether it's additional things to help support family caregivers or help people live in their homes and communities as they age and help address some of the challenges, whether they be physical, emotional, or financial, of helping people live in their homes and communities where they want to be, and then supporting the people that help make that possible.
You know, I think it's interesting when you read about this issue, you hear caregivers referred to so frequently as the backbone of our nation's healthcare system. Yet at the same time, it's this enormous backbone that is unpaid, you know, so unrecognized, untrained. A lot of concern on the part of caregivers. I'm doing this, but I don't know what I'm doing. Are there other supports that you think should be forthcoming for them, if not on the federal level, on the state and local level?
Yeah, absolutely. And I actually think states are on the front lines right now of this issue and are, in fact, innovating. You know, just to take a step back for a moment, I mean, I think the supports that we're talking about that family caregivers need are both more affordable and accessible options, care options, right? Affordability is an enormous issue here. The second is we do need more supports for family caregivers, whether they are caregivers in the workforce or they have left the workforce. But we really need to acknowledge policies like the importance of paid family medical leave, for example, the importance of, in workplaces, being able to telework, being able to have flexible schedules. There's a lot of innovations actually employers are beginning to talk through about how do they change the culture in their place of employment to really acknowledge people's growing caregiving responsibilities. And then the third aspect of this is that we do need to grow and strengthen a paid caregiving workforce. That many working family caregivers actually do depend on a paid workforce in order to be able to stay in the labor force. So it's in states like Hawaii a few years ago, Caring Across Generations helped to win legislation called the Kupuna Caregiver Program, which was a financial benefit provided to working family caregivers that can be used towards respite care, transportation, home care services, et cetera. And we're seeing a similar bill being introduced in Washington State, and then a number of study bills that are happening in places like Michigan, in Illinois, and other places where this issue of care and what are the care needs are really emerging. And there's actual coalitions, to your point earlier, of all the organizations coming together that are beginning to really look at what are the local needs and how can we develop the kinds of policies we need.
Yeah, and I think we've seen also about 40 states pass something called the CARE Act. The AARP's worked on with various partners in different states that deal with issues when a loved one comes out of the hospital, and making sure that the family caregiver is identified in the medical record, that there's notification to the caregiver prior to discharge, and opportunities for training on the kinds of tasks and things that the family caregiver may be doing when the person comes home from the hospital as well. So I think there's an array of solutions.
And before we go to the audience for questions, Rhonda, I did wonder if you wanted to chime in on what Sarita mentioned about employers, because I just think they're such an important piece of this puzzle. I mean, the cost, I think they say to U.S. businesses today, of all the different complications when it comes to caregivers, either having to take time off, cut back on their hours, just not even really being present when they're physically present at work but not mentally present. They don't call it absenteeism, but it's a problem of presenteeism. But costing $33 billion a year, that's huge. So do you think employers will start stepping up to the plate more?
Yeah, I think we've seen this. We've seen this some, and I feel fortunate to work for an employer that has caregiving leave and workplace flexibility and things like that. That's been helpful to me and as a caregiver myself. Also, AARP has tools and resources and whatnot for employers to try to help them be more aware of the issues and how they can support family caregivers and things like that. So,
what about tools and resources? Say if you're a caregiver and your company doesn't have that, so do you have something that they can take to their HR department and say, "Hey, this would be really great"?
Yep, that could certainly be an option as well, and we have resources and tools for caregivers as well, for caregivers themselves.
Because it sounds like the employers, the business community is going to have to be part of this solution.
Yes.
Right?
Yeah.
All right, let's go to the audience, and we have a question back here in the back, and if you would identify yourself, please.
Raya Vaflor. I'm with Hickok Cole Lifestyle, and we're a design firm that is very focused on creating great urban environments for everyone. And we actually worked on a project right around the corner called Mission First, now Plaza West, which created affordable housing for grand families and that kind of caregiving environment, because in DC in particular, that is a really big part of this community. So my question is, and thank you all on this panel for sharing so many of your personal stories. It's amazing to have this really great conversation about this. I'm personally living this too. I'm raising an 8-year-old and taking care of my father who just had a stroke, so really close to my heart here.
Thank you for all you do.
No, thank you for everybody. but I'm actually interested in, so I'm thinking about my daughter's school crossing guard, Miss Stacy, who is a 62-year-old woman, never went to college. She works as a crossing guard part-time and also at CVS. What are the policies and initiatives that are going to support people who are not salaried employers or happen to be in the gig economy? I know there's a lot of great companies that are looking at this in a way for salaried employers, but what are we going to do for people who are not in those same kinds of environments?
Such a great question.
Yeah. No, I think there are, a range of different solutions, from having tools and resources there in the community that they can access for different kinds of supports, to policies like tax credits that may help people with some of the financial challenges of caregiving, regardless if they're self-employed or whatever the case may be, and having communities that are more livable and enable people to stay in their homes longer and have the kind of infrastructure and supports that people need, and create some of those community resources and relationships both in the private and public sectors.
I would just add to that, I really appreciate your question, because I think it is easy to forget that there is a growing population in the US that are actually low-wage earners and what happens to them. And so we are really advocating to have a really new orientation around this issue and really look at family care agenda and policies in a more comprehensive way. And in fact, we have been exploring the idea of universal family care. What would it mean to have a whole new social insurance program where everybody pays in, everybody benefits, and could access benefits around childcare, elder care, and paid family medical leave? Like, paid leave, but how do we have policies that actually follow people's real lived experiences and needs, regardless of how they're employed? And I think that is the opportunity and the promise of the moment right now, given how many people are being touched by this issue, that we need bold policies on this front.
Exciting. That sounds fascinating. All right, another question. All right, here. Or do we have one here in the front? Let's go to the front, then we'll go there. Sorry, just a moment.
Hi, I'm Becky from the Association of Maternal Child Health Programs. And earlier we mentioned that the caregiving population is getting younger.
Yeah, right.
And I graduated from university this past May, and I knew several students and peers who were caregiving in addition to going to class, which obviously is not that easy to do. The flexibility of your class schedule, and you don't even have the first priority to pick your classes at the specific times that work for you. So I was just wondering if any of you knew of states that were universities that were doing things that could help these students, or states that were making universities do something to help these students, or if there's anything about that you want to talk on.
Excellent, thank you.
Do you want to go ahead? Yeah.
Well, I think more young people are caregivers. I mean, millennials, 1 in 4 millennials, 1 in 4 caregivers are millennials, about 10 million. But you raise a good point about the challenges of juggling, education and things like that. I think it's worth, talking to colleges and universities and administrators. I don't know a particular state off the top of my head, but I would think also at colleges and universities, there are faculty and staff and things like that who are caregivers also, who may be more understanding and sympathetic to the experiences of students who may be family caregiving. So I think it's starting conversations maybe right there in the local community around and finding other people that are in similar situations and seeing, what steps you might be able to take locally and what supports and things might be helpful.
Yeah, I would just add to that there are infrastructures in place. Like there are many universities, particularly public institutions, that have figured out how to provide childcare supports to students. And so how do you build upon those infrastructures and start those conversations? I recently did some research on employers and looked at Emory University that has a really pretty amazing system for their staff and faculty around really acknowledging their caregiving needs and responsibilities. And I think universities like that have created that system are, to your point, having students now engage in those conversations. But it goes back to what we need right now, which is we need multiple stakeholders in this conversation, innovating together, not in silos, but together, again, to match up with people's real lived experiences. And we need to acknowledge this is a multi-generational issue. It is not, we can't look at it generation by generation, but across generations.
That's going to have to be the last word. I'm so sorry we ran out of time, but Sarita, Rhonda, thank my wonderful guests.
Thank you.